This is Dr. Lily Boych, and I'm a licensed physical therapist in the state of Washington. Welcome to Back Pain Coaching Program, or Back Health Coaching Program, even better. We'll start with our bonus video that will help you understand dynamic of lumbosacral hip complex, and understanding dynamic of lumbosacral hip complex and how your spine is built and how it functions will actually help you get better. Spine is actually a pillar of your body and gives a stability, upright posture, and actually allows for shock absorption. And it's made out of bones, as you can see, discs, ligaments, muscles, nerves, and it can move forward, it can move backwards, it can move to the side, and it can actually rotate. Movement is produced in between small facet joints on the back and by activation of the muscles of the spine. SI joint also has certain mobility, and it can move forward, back, it can outflare, and it can inflare, and all movements, and actually SI joint is a foundation of the spine. Mobility of the spine and SI joint can be normal, physiological, or abnormal. And normally we have a little bit of curvature in the lumbar spine, giving us stability. The body naturally uses systems of muscles to perform most everyday movements, and those muscles work in synergies. For example, when you're getting out of the bed, in order to perform that task, it's required that the abdominal oblique muscles work together with the hip adductors to accomplish this movement. And there are a lot more muscles involved in this movement, but I'm just simplifying everything for the perfect purpose of this video. The core is very important, and it gives stability to the spine, and it's actually made out of a lot of muscles and structures, and it's actually, the core is where the body center of gravity is located and where all movement originate, and that's why you consider it powerhouse of your body. Active individuals with stable core can activate muscle, and they have really strong powerhouse, and that's actually preventing injury. Stable, strong, and powerful core prevents injury and allows for acceleration, kicking, deceleration, moving, stabilization during the dynamic movements, lifting. So the core is made out of two stabilization systems that we call local and global core system. And a local system actually stabilizes muscles that attach directly to the spine and vertebra. And those are deep muscles of the spine, and they have a lot of endurance for maintaining posture. And the primary muscles that make up the local stabilization systems are diaphragm, transverse abdominis, internal oblique, multifidi, pelvic floor musculature, and a network of fascia and connective tissue. Training the core, the local core muscle, achieves increased spinal stiffness and stability, which decreases transitional and rotational forces and stresses on the spine, decreasing the injury and helping spine heal. Diaphragm is actually the roof of the core. Since the diaphragm is creating the ceiling or the roof of abdominal cavity, it is very important to know how to contract and recruit the diaphragm because it is actually also producing intra-abdominal pressure in abdominal cavity, which allows to decrease compressive forces across spinal segments. Simply being able to contract your diaphragm can help you prevent injury and produce optimal movement and heal injury as well. Learning to breathe with diaphragm and abdomen rather than chest and accessory breathing muscles that you have in your neck is extremely useful in pain relieving and improving performance. Chest breathing can actually alter your head position due to tight neck muscles because we breathe from our neck. Tight chest muscles and neck muscles position our head in a forward head posture. And there's a theory about pelvo-ocular reflex that actually is making our pelvis actually change the center of the gravity and move forward together with the neck, affecting low back pain. So breathing from your belly is very important. Pelvic floor is also considered the floor of the local core. Having weak pelvic floor muscle is common among adults, It can destabilize your back. Weakness of pelvic floor can go unnoticed for a very long time, and it's very common among females and female athletes, and it's causing stress incontinence. The good news is it can be very easily treated with physical therapy. So other than local muscles stabilizing your back, we have global muscles that perform gross trunk and extremity movements. Those are muscles. They're more superficial. They're not so deep, like rectus abdominis, latissimus muscle, external oblique. And for optimal movement of the spine, we need all those systems and all those muscles to work together in synchrony. And we need proper length-tension relationship, force coupling relationship, and joint arthrokinematics to be normal for symmetric, powerful, and optimal movement to occur. So optimal length tension simply means that the muscle cannot be too tight, too overactive, or too weak and too underactive. If muscle is too tight and too short, it needs to lengthen. If it is too weak, we need to actually make it stronger. Synergistic activation is very important. That means that muscles have to actually activate together for the movement to occur in the spine. For example, to get out of the bed, we need to activate abdominal oblique and adductors, muscles on the inside of your thigh, for that movement to occur. And for that movement, we need to strengthen muscles, synergistic muscles. And joint kinematic is very important because, simply put, having normal joint movement and joint integrity is important for spine to move forward, back, to the side, or rotate. Thank you very much.